Good evening. My name is Tom Harper, and I'm going to be discussing the Ebola outbreak that occurred in the United States in 2014. So just a little bit about Ebola. Ebola, previously known as the Ebola hemorrhagic fever, is a rare and deadly disease caused by an infection with one of the Ebola virus species. Ebola can be spread from human and non-human primates such as monkeys, gorillas, and chimpanzees. The host is thought to be the bat, which will become infected, and then other animals will eat the bats. The Ebola virus is a member of the Filariae virus family, along with the Marburg virus. Together, they are commonly known as the filovirus pathogen that cause hemorrhagic fever in humans and non-human primates. So, transmission of Ebola. Ebola is transmitted among humans through close contact of physical body fluids or infected body fluids such as blood, feces, and the vomit. Ebola virus is also detected in breast milk, urine, and semen. You can catch Ebola through contaminated surfaces, so a prevention method is to just keep your surfaces clean and disinfected when you're at home or out and about. Early symptoms of Ebola. So symptoms typically show up anywhere between 2 and 21 days after the infection has occurred. Some of the symptoms include high fever, headaches, joint and muscle aches, sore throat, weakness, stomach pain, and a lack of appetite. These seem similar to the cold and flu symptoms, and that's why a lot of people who come in infected are thought to have just the common flu. As the disease gets worse in the body, you can develop blood in the feces and diarrhea, and a rash as well, similar to tuberculosis and HIV rashes. There is no cure for Ebola. However, researchers are looking at a vaccine. So common methods to treat the symptoms of Ebola include fluids and electrolytes to prevent dehydration, oxygen, blood pressure medications to stabilize blood pressure, blood transfusions, and then treatment for other opportunistic infections. So there have been 33 Ebola outbreaks in the in the world since 1976. However, in 2014 was the biggest outbreak ever. It killed more than all the other outbreaks combined. The Ebola virus outbreak started in Guinea and spread to Sierra Leone, Libya, and Nigeria. It traveled to the United States when a traveler from Liberia came into the United States and was infected. He passed the infection on to a healthcare worker who was treating the patient without personal protective equipment. Past epidemics. So the hardest hit epidemics between 1976 and 2013 have been the hardest hit was the Democratic Republic of Congo, with roughly 600, a little bit more than 600 cases reported. The second hardest hit was Uganda. Uganda was able to stop the spread of the disease rapidly by using a mass media prevention strategy. So to prevent the outbreak from occurring in the United States again, we have to utilize laboratory testing to rule out false positives of the flu or other symptoms, using questionnaires to get a full history from suspected patients that get their travel history, their symptoms, timelines, and persons they may have come in contact with similar symptoms, and then isolate these patients right away, and then collect information from others that may have come in contact with them. Isolate all our patients until the laboratory tests are confirmed, and treat all patients as soon as possible. The only way to control the outbreak is to investigate it properly, and that includes training your public health workers to find all persons who may have come in contact with an infected person. They have to be watched in isolation for 21 days. If there's no signs and symptoms of Ebola, then that's good. That means the prevention worked. However, we need to utilize campaigns and get their message out to the population to control in the infection and let them know how they can prevent it. So in 2014 was the first year that we saw Ebola in the United States. There was a total of 11 cases, 2 reported deaths, and 7 of those or 9 of those have been recovered. In 2018, there is currently 0 active cases in the United States. So we need to prevent this from occurring in the future. And again, it's just educating our public, putting our public health officials on notice as soon as an outbreak is noticed, and doing the due diligence to track down all infected possible parties before it spreads even further. And here's a list of references. If you have any questions, I'll gladly answer those. Thank you.